just came to mind sitting there that most of you in this room are nursing students. And I wish that you were able to experience the things that I experience every week in the hospital. On Sunday, a woman came in who was diagnosed a year ago with breast cancer and elected not to do anything about it. So here a year later she presented with a massive, open, I can't even describe, it was so unbelievable, wound that was this gangrenous and oozing, and I mean, it was just amazing. So the point is that we have education and we have prevention available, and she chose not to use any of that, so now all she can get are pain medications. More education needs to be given on MRSA because it continues to rise. Infection control is everyone's job. It's a cultural change that encourages compliance from workers to use their own voice to implement prevention strategies. Pittsburgh VA hospitals used this strategy, and they had a 30% reduction in their hospitals, according to a 2009 article in Infection Disease News. MRSA should not be feared. We must stay healthy and use knowledge as power. First, let's discuss the fact that MRSA is increasing. And second, what the causes are for that increase. And third, there are a lot of solutions that we can all use to prevent MRSA in our lives. As a nation, we must educate the public on infection. First, let's look at some facts. MRSA rates continue to increase in the United States annually. The United States has one of the highest MRSA rates in the world. According to Orrin Payne in his 2009 article in Angelus magazine, 2.3 million Americans in 2007 were infected with MRSA, and over 19,000 died. In 1974, 2% of staph infections were caused by MRSA, and 30 years later, that number has risen to 64%. U.S. Congress began deliberation effects in 2008 to strengthen prevention and research strategies. Unacceptably high MRSA rates were the reason for that intervention, according to Lautenbach's March 2008 article in Annals of International Medicine. Community-acquired MRSA is affecting the age group under 30. Now that we've reviewed the problem of increasing MRSA rates, let's move to my second main point. Lack of education contributes to the cause of the rising MRSA rates. Overprescribing antibiotics has led to resistance. According to Debbie Noble in a 2009 article in MedSurg Nursing, healthcare providers overprescribe medications because they're not always sure of the outcome, so they cover themselves with an antibiotic. Patients today demand that they don't leave the doctor's office without a prescription for an antibiotic, or they don't feel that they've been properly treated. The CDC is not enforcing national infection controls in public facilities. According to the May 2009 Canadian Medical Journal, the emergence of community-acquired MRSA, it's affecting people that have no predisposing conditions, and it's a potential for offices and clinics to become silent reservoirs for infection. According to August 2009 article in Nursing Journal, a 6-month trial, they added an additional employee for 40 hours a week in a clinical ward, and it reduced the infection rate 32% for a 40-hour employee in 1 week. So, I mean, it just shows that we need more help out there. Healthcare workers remain the #1 mode of transmitting MRSA. Education is necessary to recognize symptoms, and education is necessary for people to understand what a MRSA infection looks like, as it usually presents and is misunderstood as a spider bite. We've discussed some of the causes for the increase of MRSA. Now let's move to my third main point. There are solutions to the causes for the increase in MRSA. We should limit the amount of antibiotics prescribed by physicians. In May 2009 article by Todd May, Journal of Family Practice, a study of inner city patients where they had abscess infections and they treated them for 7 days by incision and drainage. And they also gave half of them an antibiotic and half of them a placebo. And the trial found that the antibiotic did no good. So a lot of antibiotics are useless. The incision and drainage is the best method. We should focus on prevention in public buildings. All waiting rooms should be disinfected constantly. There should be alcohol-based sanitizers in all the public offices. We should monitor our healthcare and healthcare settings. Make sure when your provider sees you that he washes his hands before he touches you and after he touches you. If you go into a hospital and you see a patient, make sure that you wash your hands before you go in the room and then again before you leave the room. In an August 2009 article of Journal of Family Practice, a study showing prebacterial counts on stethoscopes showed a 28% bacterial rate. Well, when the physicians were asked to rub their stethoscope with the alcohol-based gel as they were washing their hands, it reduced that rate to 3%. But many doctors are not washing their stethoscopes, as I can attest firsthand. Patient education from the nurse is critical, and that's one of the most important things out there. We should educate our families by practicing safety measures. And that is the daily bathing reduces skin infections. Don't share your personal items. Towels and sheets should be washed in hot water regularly. Clean your household surfaces often. Baby toys, handles on the doors, refrigerator doors. Use 1 tablespoon of bleach to 1 quart of water. Today we've talked about the increased rates of MRSA. We've talked about some of the causes of MRSA. And finally, some of the ways that we can protect ourselves, some of the solutions of how we should protect ourselves against MRSA. I hope I persuaded you about the importance of education and prevention, using knowledge and power as precautions. As we've learned, the largest sector is people under 30 years old, which affects the majority of you in this room. So congratulations, you're all fully armored now and ready to shield yourself against this silent killer.